One of the ways we can really build trust with our clients and maintain that trust throughout the massage treatment is how we drape them. So it's very important to have a professional atmosphere with your clients. They will trust you if you're not sloppy with your draping. They will trust you if you are taking good care of them and always being conscious not to expose them. The last thing a client wants to feel is a breeze in their nether regions. That means the sheet is not covering them properly. And yeah, it kind of takes away that layer of trust. So you can see our client. We have a new client for this lesson. This is Amy. You can see how as she's on the massage table, the sheet comes right up to her neck, even to the hairline. I've got an extra towel for comfort and warmth. I find the extra towel, having that extra weight on top of the sheet, because the sheet can be quite light and loose. It could slip off. If you're using white sheets, they might be a little bit see-through. So if the client has black or dark colored underwear and you've got a light white sheet on there, you know, it's going to be showing through, and that's not a good idea. So I always have extra towels, full-length towels, bath towels, beach towels that you can put over top of your client. And it just gives an extra element of safety, and it's more comfortable for your client. So what this does is this extra weight makes them feel more secure, makes them feel more grounded, and also it just covers them a little bit better. As you'll see when we do some detailed draping of the legs, that the towel, because it's a separate sheet, a separate item, you can move it in different ways from the other sheet. So the towel can be adjusted differently than the sheet can be adjusted. So it will help out that way. All right, so come on this side here. When we're working on the arm, if we're just going to be working on the arm, we only need to expose the arm. Like I've said in the past, if the client's going to be a couple degrees colder than you are going to be as you're working on them, because they're not moving, so you know, there isn't a lot of blood flow going through their body right now. All right, so just take corner of the towel, fold it over like that at the diagonal, and then you can do the same with the sheet. And there you go. This is all you need to expose if you're going to work the arm. And then from there, again, we can talk about the border. So because the chair is a little bit lower than the massage table, I've used a pillow for this demonstration. And then you can see it's actually raised the height a little bit more. If I had a towel, it might be a little bit lower and it may not be as comfortable for the client. So this is how you would start to work on the arm, and this is how you would drape the arm. Some people like a little bit of a rolled up towel at the side, just a little bit to cover the sides of their breast, makes them feel more comfortable. I've just folded the sheet here, which is also acceptable. So that's how you would drape the arm when you're working on that. And when you're returning the draping as well too, you have to be careful and conscious as well too. So do it gently and with care. And sometimes it's nice just to add another, hey, you're in good hands. I got you. Are you comfortable now? You know, as a child, we were always tucked in before we go to sleep. Our parents would come in, pull the covers over us, give us a little hug and a kiss. That was always nice. Don't hug and kiss your client. That is inappropriate. Hug and kiss your children. But just a little bit of a, hey, you're in good hands. You're supported. You're nurtured. You're cared for. Okay? Now, if you're going to be working on the back of the body, okay, we're going to bring the sheet down to the waistline. And usually we request the clients will have underwear, mandatory. So then we have a border. We've talked about this in the first few lessons, but we can just go over it again. Tucking the sheet into the underwear, tucking it into the sides, pulling the shoulders back from the ears, or pulling the arms back from the shoulders. There you go. Now, to bring it back, just a little bit of a tug. and there. So there's different drapings for how you would do it when they're face down, and also there's a change of draping when they're face up. Different elements are in play. Obviously with female clients, you have to be more conscious of the draping over the chest. Male clients, you can expose their chest. Female clients, we do not. Okay, now I'm going to go on to show how to do the draping on the leg. And just to be clear, in our style of massage, we do not ever expose the buttocks, okay? The buttocks are always going to be covered with a sheet or a towel or both. And then we have kind of the no-touch area here. So this is always 100% guaranteed to be draped and never exposed, right? This area right here. We've got a 6-finger rule as we're coming up. So the towel or the sheet is going to be cinched against the inner thigh, much like how a baby's diaper would fit like that. So I'll do on both sides, and I'm not too sure if the camera angle, if you can see it from there. We'll start just by moving the towel back out of the way like that. Okay, it's really the sheet that we're going to be wrapping around. And there's a few different parts to the puzzle here. First, we find where the buttock meets the leg, and we can put our finger right here. And then we're going to draw the sheet from the underside to there. Okay, and this is very important. One thing that you want to make sure you have access to is this edge. Okay, so as we expose the leg just above the knee, okay, we want to make sure we have access to the edge of the sheet, because this is what we're going to reach for when we come underneath the leg to pull it at a diagonal. And as you pull it up at an angle, the sheet will cinch closely to the inner leg, to the inner thigh. Okay, so you can see I have access to it. Now, with this hand, I want to bring the sheet up just to the 6-finger mark. Okay, so you've got half of the leg exposed and half of the leg covered. Okay, now I'm going to bend the leg right here. We're going to lift up and reach underneath the leg, grab that corner, and as we pull it up at the diagonal, you can see how it cinches very neatly and very securely around the client's leg. And voila, we have our 6 fingers exactly. So the sheet is exactly covering 6 fingers to the crotch. So this is the perfect way to drape. And then, as I said previously, now you can use the towel to again give another element of safety and security. Okay? Now to undo this process, we can just bring the sheet like this. And again, you want to make sure as you're undoing it that you're not exposing on the undo. And this is one of the things that the students in our in-person courses have a little bit of a struggle with. So we usually have to do it, a few times for them to get it. So that was the left leg. Let's do it again on the right leg. Okay. So just moving the towel out of the way. Okay. Where the buttock meets the leg, put your finger right there. Now it's almost like you're accordioning the sheet. You've got an accordion, they've got different folds on either side. So, because you want to make sure, if you do it like accordion style, then you can get the edge. This is what we're after, the edge. So once that's pinned, scoop the sheet. And if you have a sheet that's oversized, it can be a little bit difficult. It is better to have an oversized sheet than an undersized sheet, but when you're doing the draping, sometimes a smaller or at least a more closely fitted sheet, not a flat sheet, but fitted to the size of the table. You don't want to be working with a queen or a king size sheet on a massage table. We use just a single or a twin, which works the best. Okay, so again, we have to have access to this edge. Now we're going to bring it up halfway. I can see the edges right here. I'm going to be reaching under with this hand now, So lifting up the leg, reaching up and grabbing this corner and bringing it up at a diagonal. And I'll do it very slowly so you can see how nicely it cinches on the inner part of the leg. And the more you pull, the tighter it gets, okay? So there you go. And again, perfectly, 6 fingers, all right? And that's the ideal. You don't want it to go higher than that. It can go lower than that, obviously, but then you're not going to be able to massage the inner leg as effectively, okay? And then again, so the client is always going to feel secure. They're always going to feel they can trust you. And it's just a very professional way to do it. And if you do it any other way, you're not a professional. Great. So we're very fortunate today to have Ricardo as our model. A lot of people think that Raynor massage is just a relaxing massage, that you can just lie there passively on the table and fall asleep. It's not quite like that, as you've seen in previous videos. It's actually deeply therapeutic in nature. And even though specifically it's meant to be working on healthy people, we kind of don't really put too much focus on fixing or dealing with conditions on a kind of treatment basis. But if anything is tension related, if the condition is tension related, then this style of massage can definitely make improvements, vast improvements in the range of motion, in the mobility of your client, and it can also make an improvement in the quality of their life and take away a lot of their pain. So this specific condition that Ricardo has, he went rollerblading and fell on his shoulder. He had a fracture of his clavicle and his scapula 10 weeks ago. He had some x-rays done. Everything's healed properly. It's been 10 weeks, so we're ready now for the rehabilitation. And this is the great example of how taking someone to their threshold of tolerance, bringing them to their brink in a safe, controlled, careful manner, while the client's breathing into the tension is going to increase that range of motion. So I'm going to demonstrate on Ricardo what the current range of motion is, what's his pain level, and then you're going to see after a 90-minute treatment what a huge difference that we're going to make. And it's just going to be unbelievable for the client. So we'll just start off. Ricardo, if you can just feel my hand on your lower back here. If you can just breathe into my hand. Okay, breath comes in, breath goes out, breath comes in, breath goes out. So we haven't really done a consultation, but now would probably be a good time. Usually when we have our client, we do our consultation before, when they would fill out the medical history form, their intake form, just describing kind of their current state of health, what condition their conditions are in, and just anything we should know about any medications that they're on, if there's any breaks, injuries, sprains, things like alcohol consumption. We'll go into a greater detail in that in the course materials. But for now, we've had a consultation before Ricardo got on the table, so I know what his current situation is. And it is an all tension-based type of injury at this point, so we can certainly help him with it. He's pointed to all the areas that are causing him some discomfort and impeding the motion, and they're all on the bands of tension. So that's the amazing thing, is when you learn where the bands of tension are, those trails of tension, those pathways, then you remove the tension, and then the mobility improves immediately. So let's just go to Ricardo's left arm. It is on his left shoulder, left arm. Okay, you see it's propped up right now. He wasn't able to have his shoulder down right on the table. It was just a little bit too much discomfort, but I'm going to support his arm right now. Keep breathing, Ricardo. Nice deep belly breaths. Try to breathe like me. What you're going to notice with clients who have injuries is they tend to lock in that pain, or to help them kind of deal with the pain, they hold their breath a little bit. It's a very short and shallow, and oh, that feels uncomfortable, so I'm gonna seize up my body. And in order to kind of overcome that, we have to encourage our clients to keep that breath flowing. Through the breath, we process out the tension, and the breath is the natural painkiller in our body. Actually, when we breathe deeply, It actually will get our body to produce those pain-killing chemicals, the epinephrines, norepinephrines. You also get some adrenaline running through your body. So all these happy chemicals are going to help you overcome and not feel the pain. And then when you don't feel the pain, you can stretch a little bit more. You can open up the shoulder a little bit more. You can move the arm a little bit better. And by doing that, you're stretching out the muscle. You're allowing the muscle to relax. And as the tension dissolves, the injury kind of resolves itself. Now, the reason we're doing it at 10 weeks, usually you should wait till about 3 months. We're pretty close to that before you work on an injury. It's perfect timing that Ricardo is here. If this had just happened, a day or two ago, and he's like, hey, I just fractured my shoulder. I want to come in and get a massage. It's like, no, go see your doctor. It's too soon, this injury. It's not ready for rehabilitation. Obviously the fracture has to heal. And we're not medically trained professionals. We are massage specialists removing tension. So, and injuries are generally out of our scope of practice. So it's very important that you don't kind of take on any more than what you're qualified for. If you feel it's something that massage is not going to help or might make worse, just refer them to their doctor. But I have a lot of experience. I've been doing this for 12 years. And this is kind of one of our specialties with our style of massage is frozen shoulder, range of motion issues. And it has been a sufficient time to heal. And I even got a CD of the x-ray. So Ricardo was prepared when he came. All right, so gently, because it is an injury, we're going to just slowly, deep breath. And just let me do all the work. Just hang loose, okay, Ricardo? Okay, using both my arms to hold. Full deep breath. Keep the breath pumping through your body. Make every breath count. Tell me if any pain. Okay, are you feeling it on the underside? Or are you feeling it right here?
Both, armpit and...
Armpit, okay. So he fractured the scapula and the collarbone here, the clavicle. So arm was in a sling for quite some time, he was telling me. And then the muscles tend to atrophy. If the arm isn't being moved, if you don't use it, you're gonna lose it. So the body has what's called conservation of energy. And if you're not stretching muscles, if you're not fully extending them, a few times throughout the day, that's why it's beneficial to be stretching every day or taking yoga classes. Then over time, those muscles are going to atrophy, which means they just get shorter and then they move less. And because they move less, you are moving them less, so they tend to get shorter again. So just like when astronauts go into space, they have to exercise for 2 hours a day, or they would just lose so much muscle mass. When you're not fighting the effects of gravity, because you're weightless in microgravity, then the muscles get shorter. So they have to exercise a huge amount of time on places like the International Space Station for about 2 hours a day. So yeah, if you don't use it, you lose it. So it's time to start using it again. So this is about, right here, is about as high up as Ricardo. Keep breathing, Ricardo. Keep it going, keep it going. And you can see how the little bit of the discomfort is causing this whole body to torque up. So would you say this is the maximum in this moment, or you can go a little bit more? So this is the maximum. If we draw a kind of an edge of a box right here, Ricardo's arm is about 45 degrees range of motion to his head. So, starting here, 45 degrees, another 45 there. Okay, and if you let your chest drop, still some pain? Okay, now if you could come and bring the camera this side, you're going to see there's definitely an imbalance by how his body is laying. You can just see it's not perfectly uniform, and you can see it's a little bit higher up. You can feel there's more tension in the side. I can feel it right here. But just for comparison's sake, this is Ricardo's right arm. Okay, this right arm is injury-free, and you can see how that made, a full range of motion. He can go right to his head, 180 degrees, a range of motion, so down by his body, okay, up to his head. So you can see the difference between, you know, somebody who has an injury, or one side has an injury, or the other side that doesn't have an injury. So let's help our friend Ricardo here. Let's make a vast improvement. So I don't know if I can bring it right to his arm in one session. It might be possible. We've done it in the past before, but we're going to definitely bring it past 45 degrees, and he's going to have a lot less pain. So we can have a separate video on that, because that was kind of the injury assessment. So now we're going to do kind of a thorough massage of the head. They say calm the mind, calm the body. So the head holds a lot of tension. That's where we do all our mental gymnastics. This is where we have a lot of thinking tension from our lives. If we're stressed out, if we're worrying about unpaid bills, or getting the kids off to school, or what to cook for dinner, or what kind of career choice you're going to make next. So if you think a lot, you're going to have a lot of thinking tension. If you cannot calm down your mind, it's very hard to relax the body. So we want to get a little bit of exposure into the neck from the shoulders. So we just pulled the sheet back right here to the armpits. It's very nice to be nurturing and supportive, just to cradle the head. Be mindful of your thought process. You want to make sure you have really pure and kind thoughts. Always be caring. And usually when I'm connecting with my client this way, it might sound silly, but the clients can actually feel your thoughts. They cannot read your thoughts, but they can feel your thoughts. Whatever kind of state you are in, it's based on the mental wavelength that you're on. So, you know, our thoughts kind of dictate our feelings, and our feelings kind of dictate our physiology. So whatever we're thinking and feeling is going to be manifested in how you carry yourself. So if you have pure thoughts and you're in a good headspace and you feel loving and caring, then your client will be able to feel that on an energetic level. And the opposite is true of that as well too, that if you are feeling negative, or you're upset, or you're angry, maybe you don't think you're letting it show, but your client can feel the energy of your emotions. So just try to be in the most positive headspace that you can be. So just having your positive thoughts of gratitude, elongating the head from the neck, just a gentle pull. And then from here, I'll show you a good position. You take your fingers, and I have 3 fingers above the ear and 1 finger kind of underneath. And I align my thumbs together. And I try to find the center point right here. Right at the base of the skull, where the skull meets the neck. And this would be the hinge point. This is on your atlas vertebrae, basically your first cervical vertebrae. Full deep breath. And just a little bit push down and pull the head back. And you can see the tissue, there you saw a little bit of a stretch happen. Full deep breath tip. Exhale. And then just a little bit of a pull. From there, now I'm going to imagine there's a line coming straight up from there. And I'm just pressing every point on that line. As far as I can go, from base to top to tip. From there, I reposition my hands again, so 3 fingers above, 1 underneath. But now, instead of having my fingers over like this from the center, now I'm going to go side by side, my thumbs here. So this is actually going to target another band. Full deep breath. And again, same thing, press down and pull the head back a little bit. And now 2 thumbs are going to be pressing along those lines as they go through the back of the head to the top of the head. Now sometimes you might find an area that's just a little bit more rigid than the other area. And when you do that, I'll have to show on this side. You can just be a little bit more focused if you come really zoom in close and just see how my thumb connects. It's very subtle, but it's a press and a pull. Press down and pull to the left or to the right, or a wiggle. Now you're trying to find, when you find that little heaviness of tension, it's just a little bit more rigid, then do something with it. We say pay attention to the tension. So acknowledge it and say, okay, there you are, tension. All right, what do you want to do? You want to go this way, that way? You want to do a little bit of a circular motion? What is needed in this moment to help this tension dissolve? And we ask ourselves, kind of below the surface of thought, is what can my, how can I position my thumb? How can I manipulate that tension so it kind of gets away from the skull and is able to surrender and release more? So I'm just playing with it. A lot of massage is trial and error. It's like, let's test this, let's test that. All right, what happens if I push this way? What happens if I do a circular motion? Is that helping to soften the tension? If not, try something else. If it is working, continue what you're doing. Okay, and then give it some reward, right? We've got warm up, excavate, reward. Okay, so we started like this. We went down the center line. We put our two thumbs together and we did two parallel lines like railway tracks. We did feel a little bit more tension up in this area, so we just stayed with it a little bit more. We just paid more attention to it. I still feel something there. But just as we learned in the previous lessons, this is on that big toe sacrum band, so actually, even though I feel the tension in the top of her head, it could be connected to the big toe. So that's something we're going to do when we move on to the next lesson. Okay, carrying on. So we have thumb width. So we have the center thumb, and then we go outwards. Now we can go another thumb width apart. Full deep breath. Press down, and a little stretch. And same thing, find those parallel tracks. And just do little bunny hops with your thumb. Trying not to drag the hair along with it, just bunny hop over top of it. And again, when you find those little bulbous areas, just explore. Try to understand what is holding that tension and how can you move it so the tension releases. If anybody's a barbecue fan out there, if you're, tenderizing meat, you basically have one of those little tenderizing mallets and you're just tapping the meat to break up the tissue. It's kind of a weird analogy to think of it in those terms, but it's somewhat similar. We're just tenderizing the tension. I'm just poking her head with a little thumb mallet, just trying to get the tissue to soften up, to let go of that tension. Break up any congestion. Now I can do both sides. Now some people, you're going to find that there's a very big difference between how people like their head to be worked. Some people like it very soft and light, others like it real hard. Some prefer more fast movements, others prefer it slow. So try to find what works best for you and your client and give them what they need, but also what's going to be effective at removing the tension. And then remembering to give it some reward. So that was excavation we were doing with our thumbs there. Really focused pressure with our thumb, kind of exploring, digging it out, so to speak, as if our thumb was a shovel. Okay, so we did the center. Then we did band here. We did another band here. Now we're going to come a little bit on the side here. So these bands of tension we're going to learn in further lessons, they actually go down to the arms. Those are the roots of tension in the arms. So full deep breath. And then press on the exhale and pull the head. There you go. And then from there, now I can go more along the side of the head. And you can still feel these different bands. And you can still feel, maybe you want to switch to your fingers if your thumbs are getting tired, that's okay. It is a little bit harder to feel tension in the head if you're a little bit inexperienced, if you haven't done a lot of this type of work. So it's good to practice on yourself quite a bit. Feel your own head. You'll know when you're on the bands because it has a very distinct, sharper sensation to it. It's sometimes hard to feel through your fingertips, but you can feel it on yourself. And then this would be a little bit of reward. Also excavation. It's kind of a reward excavation. When I'm doing this part of the head, these circular motions, I'm pulling the skin of the scalp over the skull. And it's a little bit of a tongue twister. You can say that 10 times fast. The skin of the scalp over the skull, the skin of the scalp over the skull. You get the idea. But it's about 50% of your force or your pressure is kind of holding the tissue firmly, and 50% is kind of gliding over the hair. So you have to be firm enough to get to the tension, but soft enough that you're gliding over the hair, that the hair is moving out of the way from underneath your fingertips at the same time as you're maintaining contact with the tension and the tissue underneath. So it's kind of like a give and take, a little bit of a soft, hard approach. You know, you have to have just enough firmness to move the tissue, but just soft enough that the hair can get out of the way, so you're not, you're not grinding on hair and pulling hair with you, because that can be uncomfortable. It takes a little bit of practice to get this right, so it's really important to practice on yourself. And if we can zoom in and get some close-ups, maybe I can just show a little bit. We can get right in close, kind of what it looks like. So I'm squeezing but loosening. Squeeze loose, squeeze loose, squeeze loose, squeeze loose, squeeze loose, squeeze loose. It's happening, almost like if you think about it, you're going to do it wrong. You have to not think about it, but just be as loose and as firm as you can at the same time. All right, firm enough so that you can actually move the tissue, move the tension over the skull, move the scalp, move the skin of the scalp over the skull, but soft enough that you're also gliding over the hair. So this is 100% gliding over the hair, and this is 100% moving the tissue. So there's a balance in between you got to find, a little bit of a give and take, a 50-50 approach. All right. Okay, moving on to now another band. This is the fifth set of bands here. This one goes right underneath the ear, and that can be quite sensitive in this spot right there. Now there's a lot of variations that you can do as well too. I've seen a lot of massage practitioners do this type of move. More you kind of see it at the salon. It's not really my favorite, but some people like it. I tend to practice what I like having done to me. You know? And you can even